Dr. Kenneth Scott is a doctor from Midwest ENT and Allergy who helps patients with sleep apnea and snoring.
Snoring is when you relax and everything flops around and it makes the sound. And sleep apnea is when it flops around so much that it starts to affect your oxygen levels in a bad way.
Dr. Scott says many of his patients who suffer from sleep apnea are overweight males, but he mentions anyone can have sleep apnea. Patients who have sleep apnea will be very fatigued throughout the day.
People have usually been complaining about how loud their snoring is, and it usually isn't just their spouse. Usually other family members, if they go over for holidays or whatever, give them a hard time.
And although sleep apnea is most common in males, Dr. Scott says women don't have the same risks of sleep apnea until after menopause.
All women actually are protected by their hormones until they go through menopause. Once they go through menopause, it almost peels that back, and then the women go to the same rate as the guys.
For patients who don't know they have sleep apnea, Dr. Scott says it could be very risky living life with it undiagnosed. He says new research is coming out saying sleep apnea could be more related to high blood pressure than people think.
There is a study that suggested that undiagnosed and untreated obstructive sleep apnea is one of the more common reasons for hypertension if you can't find another medical reason for it.
A CPAP machine or a dental appliance is usually recommended to fix sleep apnea, but there are surgical options. The most common one involves removing the patient's tonsils.
Traditional sleep apnea surgeries is called an uvulopalatopharyngoplasty. It's a long word that basically is tonsils plus. We remove their tonsil tissue, we tighten up the tissues, sometimes we put some stabilizing for the base of their tongue so it doesn't fall back.
Dr. Scott ends by saying if you or someone you know thinks you have sleep apnea, he says there's a good chance you could have it.
They estimate that 5% of males probably have it in the United States. That's a lot of people. And so if you think your spouse has it, they probably do have it, to some extent. Or if you are the person that's snoring and are being told by your bed partner that, you should get checked out, you probably should. 1 in 20 chance is pretty significant for medical things.